Namaste. I'm Dr.Shwetha Anand. I'm a fertility consultant, high-risk pregnancy specialist, and a laparoscopic surgeon as well. I practice at Basaveshwar, Nagar at a center called Janisthaa Fertility Center and Hospital. Abnormal uterine bleeding. What do I mean by abnormal bleeding is any woman who is experiencing difficulty in cycles or difficulty during the periods or in between the cycles. So any menstruation that is happening apart from her regular menstrual cycle, we term it as abnormal uterine bleeding. In a woman, cycle should happen once in 28 day to 35 day. The period should last say for only about 3 to 4 days and there should not be excessive bleeding. Whenever her period is out of this window, it means to say that there is an element of dysfunctional uterine bleeding. So when do we diagnose this? Dysfunctionality could be when there is excessive flow during periods. See, they should not change more than 2 pads in an hour. So whenever they are passing a lot of clots, so women generally know when they are passing excessive clots. So when they are passing excessive clots associated with pain or giddiness and difficulty to carry on their day-to-day activities, that is significant enough for them to go visit the doctor. In case if they are bleeding for more than 7 days, which can last up to 21 days also, so this is also a type of dysfunctional bleeding. So either there is increase in the duration of your menstrual cycle, or if there is increased bleeding with the passage of clots during the menstrual cycle, these also formulate dysfunctional uterine bleeding. What happens sometimes is in between the periods there will be spotting. So some people will have spotting, then some amount of bleeding, and then again bleeding stops and again they will start to have spotting. So these kind of irregularities also are a part of dysfunctional bleeding. Now, what is the reason for this? When do we find this? So usually we can find this in adolescence. Initially when they have their menarche, so their ovarian axis and the pituitary axis is still not in alignment. It is then when you have the kind of period irregularities, but then this one will set in 2 years' time. Now, the most important is the dysfunctional bleeding in perimenopausal women. So what happens is around 35-40, people will start experiencing some kind of menstrual irregularities as they advance in age. Like irregularities, what I mentioned earlier. Now, what are the reasons for this? So many a times, there could be no reason. Everything would be fine. Uterus could be fine, ovary could be fine, and then there are no fibroids or anything. These are purely hormonal related. So whenever there are hormonal irregularities, even then it results in an abnormal cycle or continuous abnormal cycle. So this happens when we don't find any reason. Now, what are the reasons to have abnormal bleeding? The first and foremost would be presence of fibroid or an endometrial polyp in the uterine cavity. So what do I mean by endometrial polyp is an extra growth which is present in the lining of the uterus. So when this is present, people generally have excessive bleeding. Fibroids as well. So fibroids can develop either from the muscle of the uterus or from the lining of the uterus, or it can be in the lining of the uterus, or it could be on the outer surface of the uterus. So fibroids also could give rise to an abnormal bleeding. Polycystic ovaries. So polycystic ovaries are mainly hormonally influence the bleeding. So whenever we have polycystic ovaries, the level of estrogens are generally high in polycystic ovaries, and because of this imbalance, there will be increased development of the endometrium, and then there will be excessive bleeding. So these are the most important reasons and the most common reasons for abnormal bleeding. Very rarely endometriosis. There's a condition called adenomyosis where the endometrial glands are present in the uterine wall. So these also called intractable bleeding. What I mean by intractable bleeding is despite all the medications, the kind of bleeding cannot be controlled by the medications. Very rarely pregnancy or an abnormal pregnancy also gives rise to bleeding. How do we diagnose dysfunctional or an abnormal uterine bleeding? The most important tool is an ultrasound scan. Ultrasound scanning will tell us what is the size of the uterus, what is the endometrial thickness, whether there is a fibroid, whether there is a polyp, is there any ovarian pathology like polycystic ovaries or an endometrioma. So the first tool would be an ultrasound diagnosis. Secondly, we have to do an endometrial biopsy. Earlier people used to call it as DNC. Now endometrial biopsy is nothing but we pass a small catheter where it is painless. We take endometrial tissue and send for testing and see whether the tissues are okay, whether there are hormonal issues, or if there are any pre-malignant conditions. Pre-malignant means pre-cancerous conditions, or very rarely presence of cancer in the endometrial tissue. Suppose even with endometrial biopsy, the bleeding issue is still not sorted, then we have to do something called hysteroscopy. Hysteroscopy is a diagnostic as well as therapeutic tool. What we do here is we insert a camera inside the uterine cavity and see how is the uterine cavity. Here we will know whether there are any extra growths or polyps or any small polyps or any other issues that is leading to the excessive bleeding. Now, how do we treat dysfunctional bleeding? Treatment is always easier when you identify a cause to it. Suppose if the bleeding is caused because of polycystic ovaries, you need to take care of the polycystic ovaries and treat it so that your bleeding is indirectly reduced by it. And if there are fibroids and polyps, these definitely needs removal. Unless and until you don't remove the fibroid or polyp, definitely your bleeding is not going to stop. And suppose if there is endometriosis and adenomyosis, then you have to aim at pregnancy at the earliest. But these are the treatment when you have a cause to it. Sometimes you don't even have a cause for an abdominal bleeding, where everything is fine, but still people continue to have excessive bleeding or increased duration of cycles. What we do here is, after we get the endometrial biopsy report, we put them on basic hormonal therapy. Hormonal therapy, we can make a combination of only estrogens or estrogens with progesterones. So these are all hormones which are available. We can start them on these medications and then get the bleeding under control. Suppose even if there is no control of the bleeding or an abnormal cycle with these medications, then we step up. So what we do here is we insert a hormone containing device inside the uterus. So these release hormones so that the bleeding is controlled instead of taking oral medications. So this is an intrauterine device. Suppose even if the intrauterine device is not working, then we have to step up. Again, there are multiple other methods where hysteroscopic we can do something called ablation, where you actually burn the endometrial tissue, or you can do a resection. So these are the multiple modalities which is available. Sometimes people get so fed up with this that they don't even want to have the uterus anymore. And if none of the medications are working, and if she is bleeding excessively, causing harm to her life. See, sometimes they bleed so excessively that the hemoglobin comes down with each menstrual cycle. So when the hemoglobin falls, it is life-threatening for them. So that time we recommend removal of the uterus, that is hysterectomy.